the significant aspects which is transforming the way healthcare delivered is the use of technology in care. And whether we're talking about the electronic health record, which is one of the major projects that FICCI is recommending to the government, that we should have a universal health record. This should be linked to the UHID. This in fact is an algorithm which was developed by TCS and Apollo and donated into the public domain so that everybody can have a common numbering system. From that, the benefit to patients would be that irrespective of which doctor they go to, they can have access to their record. This will enable a continuum of care. This will also be linked or can be linked to devices. So whether they're wearing a Fitbit and they want to track their number of steps, or we're moving on to an acute patient who's linked to a cardiac monitoring and you want this to happen at home. All these are enabling underlying technologies that need to be integrated for a more evolved healthcare system which uses technology appropriately. I think there's a great need to have a universal health portal where patients can just log in and find which is the hospital closest to them, what facilities do they have, and which insurance coverage. So are they empowered to go into that hospital? Imagine for an Arogyasri patient, how would they find out where they're supposed to go, or for an Ayushman Bharat patient? So there's a range of technologies which are evolving, which the country would be very much benefited by creating. And I think the time has come now to also find ways to manufacture technologies in India so that the cost comes down. Because right now, every new hospital spends a tremendous amount of money and almost 17% of their budget annually on replenishment of new equipment and technology. So people who are talking about bringing down the cost of healthcare must clearly understand that one of the biggest input costs, the first, of course, is the cost of the manpower. But the second large input cost is the cost of materials and the cost of the large equipment which is used in hospitals. Unless we find ways to bring down that cost, it is very difficult to bring down the cost of care any further. What is more important is to find mechanisms to enable, like insurance, which enable us to defray this cost of care across the population and not just on the family who has someone who is ill. The next important aspect is to focus on preventive healthcare so that people do not get extremely sick, or the number of people who get sick comes down and the overall burden of disease in the population is reduced. This can happen like we have done in our village in Aragonda in a project called Total Health. You first focus on the social determinants of health, which is clean drinking water, sanitation and nutrition. By taking care of just these three, you will significantly reduce the incidence of disease. Then you move on to the provisioning of care and screening and early detection, and the biggest burden, which is NCDs or non-communicable disease, find ways to screen, to monitor and keep under control the non-communicable disease, whether it's blood pressure or diabetes or obesity. These three single factors are contributing to the largest number of advanced surgeries which are happening because of these uncontrolled conditions. So an overall holistic view to care, a proactive intervention at the right time, an ability to share the skills and the resources available across the ecosystem at the point of care using technology, and finally artificial intelligence to enhance and enable doctors to handle more and more complex situations. All these are things which will happen in the future of healthcare, and we look forward to this making India healthier and happier.
For more updates from CXO TV, please like and subscribe to our channel.